Well, after graduating high school, went to Duke University, got a degree in chemistry, then went to Tulane University for my medical degree, and back to Atlanta, Emory University for my internship and residency in orthopedics, and then out to Salt Lake City for a one-year fellowship in sports medicine and surgery of the knee and shoulder. I operate 2 full days a week, and the other days I'm in the office, usually by 7 a.m. During office days, we're seeing patients the entire day. In surgery days, it could range from 8 or 9 smaller surgeries to 4 or 5 joint replacements. My surgeries in sports medicine, a lot of shoulder and knee surgeries. The other part of my practice is joint replacement, both knee and shoulder joint replacements. I've spent years covering teams. I covered high school football teams all through residency. I covered many of the Olympic teams and Paralympic teams as well, both in 1996 here in Atlanta and again in 2002 in Salt Lake City, where I covered the U.S. ski team and the freestyle venue. My approach to patient care is pretty simple approach. I have stood the mantra that we try everything possible that's non-surgical before we entertain surgery options. There's obviously exceptions to that if you're dealing with fractures that have to be fixed quickly. The vast majority of things we see in the office are not emergencies, and you have plenty of time to try many other non-surgical treatments, and the majority of patients will succeed with that approach. In the field of orthopedics, I would be considered more conservative than most, but I think it's an approach that works. And when patients decide that, time has come for their surgery, they know they've tried all the other options, and I think that decision's much easier, and I think they tend to be more successful with their outcomes. So patient communication, I think it's a two-way street, trying to make sure patients understand what their conditions are, what our treatment plan is. It is very often that patients leave, and even within a couple hours have sent us a message. I forgot to ask this, or I left without getting my exercises. So they either call and we have somebody forward a message to us, or you go into the patient portal, which is the easiest way. There are several things I would love every patient to do. Write down your questions before you come in. Write down the questions your wife or your husband or your parents want you to ask. Take notes when you're in the office. We talk back and forth for 5, 10, 15 minutes. You're not going to remember half of what I told you. Do the simple things that we advise. Ice and stretch, and really think about your activities you're doing every day. And sometimes those little treatment things like ice every day or stretching every day can be hugely effective. We tell you certain things that we think are your best treatment options, whether it's therapy or exercise plans or medications. Think hard about doing what we recommend, because they're in your best interest. As orthopedic surgeons, we're programmed to fix problems, and the things we recommend are usually tried and true and the best chances of a patient getting better. I've been practicing here now, starting my 24th year, and I have patients who I've seen for 24 years and now have seen their children and started to see their children's children, their grandchildren. The most referrals I get are patient referrals, not the ER, not other doctors. It's patients at this point. If that's happening, I see it as a good sign that we're taking care of our patients like we should. Piedmont Orthopedics, Ortho Atlanta, great team approach. A fantastic hospital system, wonderful medical assistants and surgical techs and nursing that makes, the team approach to patient care work.